Hi friends, I am Dr. Pratap Sinator. I have done MD in Forensic Medicine. In today's video, we will continue with agriculture compound poisoning. Last video we discussed about organophosphorus poisoning. In this video, we will discuss about carbamates, organophosphates, endrins and other compounds. First, we will discuss about carbamates. They are derivatives of carbonic acid. So, derivatives of carbon leads to carbamates. They are marketed in the form of synthetic forms like baygon, poplar baygon, which is used for the insecticides. Others include aldicaps, aminocaps, carbalates, saving, carbofurans, and etc. They are absorbed through all routes, like from inhalation they can be absorbed easily, or from the skin if any part is found can be used, or by ingestion, which is commonly a person may try to consume and try to commit suicide by ingestion. It can be easily absorbed. Carbalate, carbofuran, methanol, or propaxura are highly toxic. Aldicrab, carbenzine, trilate are moderately toxic. Comparatively, they are moderately toxic. Coming to action, they are also anticholinergic and inhibit carboxylic esterase enzymes by carbamylation. So, organophosphorus they used to cause hydrolyze the esterase enzymes, but carbamate cause carbamylation of carboxylic esterase enzymes, and also they are anticholinergic in the sense they also cause similar symptoms like organophosphorus compounds. Coming to signs and symptoms. Symptoms begins 15 minutes to 2 hours after the person consumes it. They differ toxicologically from organophosphates in 2 points. One is they spontaneously hydrolyze from cholinesterase enzymes site within 24 to 48 hours, whereas organophosphates will not. Organophosphates usually when they start adhere, they completely after 24 hours they cannot be removed. So after 24 hours they cannot be removed because of they completely adhere with them. But here the carbamates are hydrolyzed, so they completely spontaneously hydrolyze and they are separated from cholesterases and do not cause severe symptoms as like that of organophosphorus. They do not effectively penetrate into CNS, whereas organophosphorus usually cross CNS as well as they also used to cross placenta as well as, and has such CNS toxicity is limited. All other clinical manifestations are similar to organophosphorus, like muscarinic symptoms, which has acronym of sludge. That symptom will be there, and nicotinic symptoms of muscular fluctuation, fasciculation will be present, and CNS effects will also be organophosphorus were similar, but compared to the CNS symptoms will be less in carbamates. Fatal dose is 3 to 6 gram of any carbamate is fatal. Coming to treatment, atropine is a specific antidote similar to organophosphorus. Atropine is given. Then pyridoxamase may diminish the severity of symptoms and help prevent morbidity. It improves respiratory functions and patient's well-being when it is combined. So, like OP poisoning, atropine plus pyridoxam is the treatment of choice in organophosphorus as well as carbamates. Coming to organochlorines, so other compounds like organophosphorus, there is organochlorines. Organochlorines are classified into 4 categories of groups. One is DDT and analogs, which include DDT methoxychloro. Then there is benzene hexachloride, which includes gamma hexachlorobenzenes, which is also known as lindane. Then cyclodanes and related compounds, which includes aldrines, chlorodanes, chlordecanes, dialdrins, endosulfans, endrins, heptachlor, isobenene, merex, toxophene, and other related compounds. Coming to absorption, all of these pesticides are absorbed through skin, orally, and via inhalation. So all the 3 routes can be absorbed. DDT is least well absorbed. These agents are highly lipid soluble and can be absorbed from any part. They are partially metabolized in liver and are directly excreted in the urine, feces, and milk. So similar to organophosphorus, they are also metabolized in liver and also they are excreted in the urine through kidney elimination. Their action, they interfere with nerve impulse transmission compared opposite to organophosphorus. They interfere with nerve impulse transmission similar to in myelin junction. CNS is first stimulated, then depressed. Fetal dose is DDT is 30 grams, gamma-axine is 15 grams, lindane is 15 grams, chloroidine is 30 grams. So from 15 to 30 grams, if any compound of organochlorines are fatal. Coming to endrins, so again, endrins is a popular organochlorines. Again, it is a form of organochlorine which is commonly present and which is fatal. Endrins are polycyclic polychlorinated hydrocarbons belonging to a group of cyclodine insecticides of organochlorines. It is a stereoisomer of dialdrins. Opposite chemically they are opposite of dialdrins. Endrin is soluble in aromatic hydrocarbons and kerosene like ketones sparingly in alcohols but not soluble in water. So they are hydrocarbons and they can be soluble in ketones and alcohol. They are bitter in taste, melts at 244 degrees. They are also called as plant penicillin because it's a broad spectrum of activity against various insect pests. So Endrins are mainly used as part of like a treatment for plants hence it is named as plant penicillin. It is sold in market with different names like Endrin V60, DB50, EC20, Endrix, Staftin, etc. These products contain about 20 to 50% of Endrin mixed with hydrocarbons such as aromatics, which is by their smell like kerosene. It is commonly used as sprays or dust or added with inert clays. Absorption Endrin is rapidly metabolized and eliminated and does not persist in body tissue, so they get easily eliminated after consumption. Symptoms begin within 1 to 6 hours person consuming. The symptoms include salivation, nausea, vomiting, abdominal pain, really diarrhea, similar to poisons. Then there is hoarseness of eyes, coughing, fourth of the mouth and nose, and dyspnea. Later on, there is headache, dizziness, restlessness, hyperactivity related to pupils, incoordinates, ataxia, mental confusion, tremors, tonic-clonic conversions, coma, and death due to respiratory failure. So all these symptoms are senior symptoms which progresses from minor restlessness to coma to death. In non-fatal cases, most of the person feels well after 24 hours. They do not adhere to, similar to organophosphor, they are not so severe because they get easily metabolized after 28 hours, 24 hours. Chronic poisoning of Endrin may occur. Long-term exposure to some of these compounds results in cumulative toxic characters by loss of weight, weakness, ataxia, tremors, mental changes, oligospermia, and increased intensity of leukemias, purpurias, aplastic anemia, and liver cancers may occur after long-term consumption. Symptoms: fatal dose is 5 to 6 grams. By ingestion, Endrin is 3 times toxic as aldrins, dialdrins, and 10 times as toxic as DDT. Fatal period is 1 to several hours. Post-mortem appearance: the mouth and stomach contains smell of kerosene because of presence of aromatics, which is again mixed into the compound. Signs of asphyxia are present, and mainly the signs includes 3 signs are usually present in it that becomes asphyxia. That is, one is cyanosis, that is bluish discoloration of skin. Then there is petechial hemorrhages, that is pinpoint hemorrhages. Then there is congestion of organs. So congestion is nothing but the organs, the blood start getting accumulated in one organ. There is congestion of any organ. Brain will be congested, liver, kidneys, all these organs will be congested. These 3 signs will be present in any death of asphyxia. Endrin resists putrefaction and can be detected in viscera quite sometimes even after death. Treatment: clothing should be removed and skin washed with soap and water similar to the other organic compounds. Gas lavage is done by emetics and catalytics are evacuated. Activated charcoal is given with stomach wash to remove an unabsorbed poison. Chlorophenoxyacetate is a non-absorbable bile acid binding anion exchange resin which increases the fecal excretion of organochlorines. It is given in 16 grams per day in divided doses for several days. So for organochlorine poisoning, usually similar to organophosphorus, the compulsory treatment starts with removing the clothes, removing an unabsorbed poison. Any part present on the skin should be washed with soap and water. Then gas lavage is given. Then specifically chlorophenoxyacetate is given, which is a bile acid binding anion which binds with organochlorine. It is given in 16 grams per day in divided doses for several days to remove the poison. There is no specific antidote compared to organophosphorus. There is atropine and pyridoxine, but there is no specific antidote. As your adequate airway, breathing, and circulation is maintained. Mental state is altered. If the mental state is altered, dextrose, naloxone, and thiamine is given. Conversion should be controlled with diazepam followed by phenobarbital. Calcium gluconate is also sometimes useful. Coming to medical importance or consequences of poisoning of organochlorines, human poison occurs from occupational or accidental exposure to endrins. Suicide is very common. Homicide is rare, but is sometimes given with mixed with food or sweets or alcohol to conceal the smell. Accident is very rare. So, like organophosphorus, suicide is common from these compounds. It is easily available because all the farmers use for insecticides so easily available, and again they are cheap, easily available, and can be consumed. So suicide is very common from these compounds. Coming to next agriculture poison is chlorophenoxyacetate. They are plant hormones used as a weed killers. There are different compounds. They irritate the skin, mouth, GIT, and damage muscles, nerves, and brain when person consume that. They are absorbed through skin, lungs, and GIT. So again, they can be they are easily absorbed from any part of the body. Symptoms occurs if the person consumes. There is a redness, irritation of skin and eyes, burning in the mouth, coughing and choking, pain in abdomen, vomiting, diarrhea. Later on, CNS symptoms like confusion, muscle weakness, twitchings, hypertension there may occur. Then respiratory system, there may be fast breathing, convulsions, and coma and death when CNS depression starts. So it depresses the CNS and later on it becomes coma and death. If patient survives for more than 3 hours, liver and kidney damage may occur. Treatment is symptom treatment. There is no specific antidote is not present for chlorophenoxyacetate. No specific antidote is present. Coming to chlorates. So chlorates are weed killers. It is used in matchheads and in fireworks. Sodium salt is more toxic than potassium salt of chlorate. It is powerful oxidizing agent and it attacks all body cells. It reacts with thiol groups on red cells and may cause it to lyse. It oxidizes hemoglobin to methemoglobin. It also is a potent nephrotoxin. So most of the cells, when it comes in contact with them, their cells starts dying. Hemolysis may liberate large quantities of potassium ion, making serum levels sufficiently high to react with fetal levels. Fetal dose is about 20 to 30 grams of chlorates. Symptoms develops 1 to 4 hours after ingestion. They include nausea, vomiting, diarrhea, abdominal pain. Later on, there is shallow breathing, proteins, bleeding from then hemoglobin in urine, oliguria, anuria, and renal failure. Hemolysis, jaundice, hepatic failure may occur. Methemoglobinemia may occur. Agitation, generalized weakness, muscle twitching, convulsions, and death due to renal failure. In the skin and eyes, it causes irritation, redness, burn, and ulcers. Treatment is stomach wash, then methylene blue 25 ml 1% solution. It is merely due to contract the methemoglobinemia which has occurred. Sodium thiosulfate 2 to 5 grams in 200 ml of 5 sodium bicarbonate as a drink is given. Ascorbic acid 1 gram every 4 hours as a drink or by solution. Slow IV injection is also given. Peritoneal dialysis or hemolysis is also provided. Then symptomatic treatment is given. Dialysis removes the poison. Symptomatic treatment is given to as if any new symptoms arise. These are my references. Thank you.